Ladies and gentlemen, welcome once again to the EULAR Expert TV show. I hope you are enjoying the EULAR 2023 in Milan, and we are delighted to have one of the experts in SLE and Sjören, Professor Ronald van Vollenhoven. A warm welcome, Professor. Thanks for coming.
My pleasure.
Thank you. You have chaired the session today in the future perspective of SLE and Sjören, and there's a lot of great work been presented there. And what do you feel like? Are we cracking the code in SLE?
I like the way you put that. This was a great session. So I had the pleasure to chair it together with Professor Nathalie Coste-Dubois-Chalumeau from Paris, and there were many very good presentations, and I also had the opportunity to give 2 presentations. And it is clear that a lot of things are happening in the world of therapeutics for lupus and also, to some extent, for Sjögren's syndrome. Yeah. And that is very exciting.
Absolutely. And where we are doing better, you think? Is it like we are targeting more specific targets, or like is the outcome where measure in the SLE has been improved?
I think there are 3 reasons why we're now seeing better results. I think the first is that we are having the results of many years of investigative work in the causes and the mechanisms of lupus and other connective tissue diseases. So now we're testing therapeutics that are based on an understanding of the pathophysiology. That's critically important. Secondly, we're also getting better at doing the trials. We have learned what the pitfalls are. We know where it can go wrong. You have to select the patients very carefully. You have to be very sure about your outcome measures, and we have made real improvements in those areas. And then I think the third thing, and that's very close to my heart here at EULAR, especially because the patient involvement. Yeah. In recent years, we have really involved the patients also in doing the trials, in designing the trials, in looking at what is important from their perspective, and that adds value to these clinical studies.
Absolutely fascinating. And last question for you today is, in compared to SLE, Sjögren's been a bit difficult, and recruiting patient is also very difficult. Any good news?
There's always good news, and you're right. Sjögren's has been a little bit behind lupus. It has not had so many trials and some that have failed, but we did see encouraging results today. I do think there's more activity now, and I personally also feel that because more of the therapies are now based on the mechanism, they will cross-fertilize across different diseases, because we are understanding more and more that the connective tissue diseases, these are clinical categories, but they break into several groups of patients where the pathophysiologies are different, and that overlaps with other diagnoses.
Brilliant. Thank you so much for joining us. Thank you. It's been a pleasure.
Thank you for having me.